नमस्कार। मैं डॉक्टर वीना सिंह एम्स पटना में प्लास्टिक सर्जरी डिपार्टमेंट में एडिशनल प्रोफेसर की तरह कार्यरत हूं और नेशनल एकेडमी ऑफ बर्न्स इंडिया के सीरीज 3 के पब्लिक अवेयरनेस कार्यक्रम में आप सभी का हार्दिक स्वागत है। आप लोगों की जानकारी के लिए बताना चाहूंगी कि नाबी का यह 33वां ऑनलाइन ट्यूटोरियल है, जिसमें हम बर्न स्पेशलिस्ट और जनरल पब्लिक दोनों के लिए एजुकेशनल सेशंस लेकर के आते हैं। कार्यक्रम में मेरे साथ जुड़े हुए हैं नाबी के प्रेसिडेंट, लुधियाना के प्लास्टिक सर्जन डॉक्टर संजीव उप्पल और मेरे वेबिनार को होस्ट एम्स दिल्ली के प्लास्टिक सर्जन डॉक्टर राजमानस। आप दोनों का बहुत बहुत स्वागत है। आज का विषय बहुत ही इंपॉर्टेंट है, कम्युनिटी आउटरीच सर्विसेज फॉर बर्न पेशेंट्स, यानी जले हुए रोगियों और जलने से हुई विकृतियों के लिए कम्युनिटी लेवल पर प्लास्टिक सर्जन एंड बर्न स्पेशलिस्ट क्या क्या सर्विसेज देते हैं तथा किस तरह से आम जनता तक अपने एक्सपर्टाइज के माध्यम से अपना योगदान दे रहे हैं। इसमें हम आपको यह भी जानकारी देंगे कि जो फ्री कैंप्स होते हैं बर्न पेशेंट्स के लिए, उनके क्या क्या लाभ हैं। इस विषय पर जानकारी देने के लिए आज के हमारे चीफ गेस्ट हैं देश के जाने माने विख्यात प्लास्टिक सर्जन डॉक्टर राजा सभापति सर। सर इज द चेयरमैन एंड हेड ऑफ प्लास्टिक सर्जरी डिपार्टमेंट एट गंगा हॉस्पिटल कोयम्बटूर. And he is well known for his uncomparable attributes as a wonderful teacher, excellent surgeon, and charismatic leader all around the world. और हैंड एंड माइक्रोवैस्कुलर सर्जरी के अलावा बर्न के क्षेत्र में सर का अनुभव अत्यधिक अतुलनीय है। On behalf of whole NABI family, I want to welcome you, sir.
Thank you.
प्रोग्राम में हमारे साथ हमारे दूसरे अतिथि हैं एम्स दिल्ली के प्लास्टिक सर्जन डॉक्टर सुभाशीष दास, a young dynamic plastic surgeon and dedicated towards burn patients. I welcome you, Dr. Subhashish, to this NABI webinar. अब कार्यक्रम को आगे बढ़ाते हुए मैं नाबी के प्रेसिडेंट डॉक्टर संजीव उप्पल सर को इनवाइट करना चाहूंगी कि वे अपने शब्दों से हमारे दर्शकों को लाभान्वित करें। ओवर टू डॉक्टर संजीव उप्पल सर।
A very good afternoon to all present on this show. As Dr. Veena has already told you, the National Academy of Burns India, it started these kind of webinars for public as well as for our own kind of technical people, doctors, surgeons, plastic surgeons. Alternatively, we have been doing so, and for the this is 33rd such webinar which we are organizing. Almost you see, because no physical conferences were being done during the COVID period, so we thought of staying in touch with our own people, upgrading their knowledge and also upgrading the knowledge of the public about the burns. आम लोगों के लिए जो बर्न्स की सुविधा कहाँ है, कैसी कैसी है, और अगर कोई जल जाए उसको क्या करना चाहिए, घर पर कुछ ट्रीटमेंट लेना चाहिए या इमीडिएट हॉस्पिटल जाना चाहिए, और हॉस्पिटल में जाते हैं तो उनको किस तरह की सुविधा मिलेगी, ये सारी चीजें हम अपनी पब्लिक से शेयर करते आ रहे हैं. And the technical part, our own people, our plastic surgeons and surgeons have been debating and discussing the various developments, the latest treatment parts for burns. So ये सारा कुछ हम अपने लोगों की भलाई के लिए करते आ रहे हैं, और हमें बड़ी खुशी है कि हमारा ये शो, ये वेबिनार्स महीने दर महीने चलते आ रहे हैं. Today's webinar is very unique, where we are trying to tell people that how the plastic surgeons and the burn surgeons are also doing their duty towards the public, going into the public and organizing camps, free camps for the people who cannot afford treatment, and also propagate the various developments in burn care. And today we have with one of the finest microsurgeons, plastic surgeon, burn surgeon, and reconstructive surgeon in Dr. S. Raja Sabapati. I have no hesitation to say that I look forward to him for anything. And probably I can list him in one of the finest microsurgeons in the world as such. No hesitation to say that. He has umpteen number of papers, presentations, awards. The list is unending. We can go for the whole day for that. And also he has almost headed every organization in the country. And now we are looking forward that he heads almost every organization in the world also. Recently, their hospital, the Ganga Hospital, which he has created, I can say from a scratch onto a 500 bedded facility, where I think nearly 100 beds are subsidized and given to the public at a very, very nominal cost. And he is open to even treat any patient free of cost. So इन सबसे देखते हुए डॉक्टर सभापति को हम वेलकम करते हैं आज के अपने प्रोग्राम में और उनसे जानेंगे किस तरह उन्होंने पब्लिक के लिए ये आउटरीच प्रोग्राम शुरू किए और हाउ इज ही कंटिन्यूइंग विद द आउटरीच प्रोग्राम्स ही लॉन्च्ड एंड इवन ही लॉन्च्ड a helicopter service for people to bring to his hospital, which was a unique service which he started. डॉक्टर सुभाशीष दास के बारे में थोड़ा कहना चाहूंगा. हमारा एंडेवर रहता है कि हम हर एक प्रोग्राम में एक यंग बंदे को जरूर लेते हैं. एक तो हम भी उनके साथ थोड़ा यंग महसूस करते हैं, दूसरा ये है कि उनका इंटरेस्ट फिर अगले 25-30 साल के लिए बना रहता है. और इस बार डॉक्टर राज ने हमें एक बहुत ही अच्छे प्लास्टिक सर्जन इंट्रोड्यूस कराए हैं, डॉक्टर सुभाशीष, जो कि ग्रेजुएटेड फ्रॉम VMMC एंड सफदरजंग हॉस्पिटल दिल्ली से उन्होंने MCH प्लास्टिक सर्जरी किया और उनका स्पेशलिस्ट बर्न्स में है और इतनी यंग एज पे वो इंटरनेशनल सोसाइटी ऑफ बर्न इंजरीज के पेशेंट केयर कमेटी के मेंबर हैं. आप उनसे इस चीज से ही अंदाजा लगा सकते हैं कि उनका रुतबा कितना अच्छा है. सो ज्यादा वक्त ना लेता हो मैं आई विल हैंड ओवर टू डॉक्टर वीना टू रन द शो एंड लेट द पब्लिक नो, लेट द डॉक्टर्स नो how do we have our outreach programs, how should we plan these programs, how should we execute these programs for the benefit of the burn victims. Dr. Veena, please.
Thank you, sir. So I would like to start with Dr. Sabhapati sir, that what is meant by these community outreach services and why is the need? What unmet problems which this community outreach services can solve, which is not being presently fulfilled by the healthcare facilities? Sir, please put some light on this part.
Yeah, thank you, Veena. So I'll share the screen and I'll start off with some of our work. No? No. So I think it's a wonderful opportunity that you are given to us to talk about this. And I must congratulate the energetic the team. And Dr. Sanjeev, in his talk, he said this is the 33rd webinar, right, Sanjeev? Correct, 33rd. So what I personally feel is that you can start anything, but then to sustain it is very difficult. I think same thing goes for this all community service outsourced. Right? Starting is easy, sustaining is difficult. But I think just like you sustain these webinars, I think we also need to sustain this. See, the first question is why are they needed? And Veena asked me now what unmet needs these camps can solve. See, what really happens is if you see the burns, the successful rates of saving is increasing, but then more people we save, many of them are also end up with deformities. Anytime the face gets burnt or the hand gets burnt and they get deformed, that means they don't go back into society. So about 10 years back, I was coming in a flight along with an incoming Rotary Club president. See, many things can start off small ways. I think I like storytelling, So, and then I was given an award in Calcutta by the Rotary International President, and many of our club members had come along. So in the flight, the incoming president was sitting next to me and asked, "Doc, you tell me a good project." Then I told him, I'm fed up of all the small peanut projects where you give some computers, we do some blackboards, we paint some this thing, make some food toilets and all that. I think that's all you must not do, I told. Then he said, "Doc, if you are telling me that you should not do a peanut project, you please tell me a pumpkin project," he told me. Okay, you told me. Then I told him, we'll do burn deformities correction, we'll do. He immediately said, yes, we'll do. I got a little irritated. I said, hey, Venke, you are not even asked me what it is. Simply you are telling we'll do. Then philosophically he told, Doctor, I got great trust in you. It doesn't really matter. I need to understand it. I only want to be sure that you have understood it. Okay, that is a phenomenal thing. He said, if you think you can do it, I think we'll go and do it. So I told him, that we will do a project where we'll treat free, totally free, 100% free, all burn deformities we'll treat. And that's how it was born. I think it was born in 2012. And we termed it as a hope after fire. It's a reconstructive surgery for burn deformities. Now it is sustained for 10 years. It's what is very important. It offers totally free reconstructive surgery, the deformity of burn survivors, irrespective of the complexity, irrespective of the number of stages that are required. I think that's. See, why is this project relevant? Means many people ask me now why you should do it, because. And the same thing now, the actor Surya, I think, who inaugurated also asked that Madangi Ramvishnu came to inaugurate it. And we wanted to do it with a lot of fanfare, so that we need to give publicity. Any big project you do, I think you also need to give publicity. I think we may be good, but we must also be good in telling that part of the story. I think that's very important. No? So he's the first patient whom he saw. He never got convinced. She was not able to lift her hands. The neck was struck. His face was bad. So after seeing this, he really got surprised. And there's the same patient. There's the first patient. And now after that, she was a schoolgirl at that time. Now he became a computer engineer, and she works in our department now. I think we made that big transformation. And why is it so relevant is, it is because of these other problems. Before that, now, I just put a small slide now. The total cost of the project, the value is about 6.5 crores. What we do is, we do the surgery free. We do the surgery free so that the money that's come from the Rotary is used only for the materials that are used. So that means now we can do a lot more surgeries. The reason is this: it needs high skill levels. Why we should know do this? And there are only a few centers now which could do this. It is the right hand of the individual. See, all the fingers are gone like this. And that's the left hand. And that's the left hand of the same. He has had some flaps somewhere, I think, here. But then if you have your right hand like this, and if you have your left hand like this, that means you can't do anything. That means your wife has to do every small bit of things you have to do. And we do a lot of series of stages we do. I think it's doesn't come by one. And he had 10 surgical procedures he had. And after 10 surgical procedures, he's able to do all his activities by himself. And more than that, he is able to take care of his family. So I'm telling why these projects are required is by big institutions required is, till you complete the 10 procedures, it doesn't become independent. I think that's the point. I always tell them, it's just like, crossing a well. Whether you cross 10% or jump 90%, the result is the same. You fall inside. Now you need to cross 100%. So it's not a 100-meter sprint, it's a marathon. If you do that, then what happens? Now we become self-employed. Now we're back on the rails again. So the reason is, then you get a happy home, happy community, and a happy India. I think that's the reason why these things are all needed. Then you may ask, why can't this all be done in an institution itself, But what happens is, the amount of time that is required is so high, I think that's the point. So there is so much of commitment is required. That means, we need to have institutions which are able to do this. I think that's my real point, Okay. Then you may ask the next question, Veena, about my funding part of it, Veena. You talk, Veena.
Okay. Subhashish, you want to add?
You want to add anything, Veena? What I said, Subhash, I think we'll have first, I think it's very skill intensive. I think we all need to go out. I think that's my point. That's necessary.
तो सर ने जो बोला अभी बर्न के बारे में, बर्न मरीजों को, जो बर्न पेशेंट्स है, उनको बहुत सारे सर्जरी की जरूरत होती है और बहुत ही कम सेंटर्स हैं जो एक्सपर्ट सर्जरी जो दे सकते हैं, क्योंकि बार बार जो मरीजे हैं बार बार इनकी सर्जरी की जरूरत है और ये बहुत ही मतलब स्पेशलाइज सेंटर में होता है। और ये सब सर्जरी इसीलिए महत्वपूर्ण है क्योंकि ये एक मरीज की लाइफ चेंज कर सकते हैं। जैसे किसी का हाथ जला हुआ है और वो पेशेंट कुछ काम नहीं कर पा रहा है, सर ने जैसे दिखाया, वो पेशेंट एक सर्जरी के बाद उस मतलब फिर से वो अपना काम कर सकता है और अपनी फैमिली को मतलब प्रोवाइड कर सकता है। सो इसीलिए ये सब सर्जरी, ये सब केयर बहुत ही जरूरी है, महत्वपूर्ण है। एंड sir, I'd like to ask what type of healthcare services this community outreach program can provide for one specifically?
If you are able to inspire people, that means that we can do anything. I think that's my point. See, we need to really tell people as to what exactly happens. And for example, if you see this child, it just happens in a fraction of a second. There's a big family function. There's a hot food that is doing there. And suddenly this child stumbles and put both hands into a very hot food. Okay, it's the sambar, they have it, they put it all inside. It just only happens in a minute, but then you find that both the hands get lost. See, then that's the left hand. So badly, both the elbow and all the fingers are gone. See how badly they are done. And that's the right hand. See, now we need to really tell people that when this happens, it's not just that hands are gone. Everything comes to a standstill. For example, the schooling stops. They can't go to school. I think imagine a girl child not going to school, the education stops. That means it pulls down a family very, very badly. Okay. But then if you are able to tell that part of it, we are not correcting the deformity. What I am telling, I always tell people is, we are trying to create a great mother, as an educated mother. I think, we just put it the other way. Okay, we are going to get a child to go back to school. Then if you put like that, then it becomes nice. Again, a series of surgeries you go, both hands, totally not useful, 100% done free. But then it goes to stages and stages. What I would say is every time we have a problem with that, what I try to do is to make an emotional connect. I think that's exactly what we have to do. You make an emotional connect to the people, and then after that, it becomes much nicer, and people are happy to will observe. And I always tell this because we do a lot of service. I think a lot of philanthropists there in the society are there, and they like to say, "Oh, I want my rupee to go a long mile. I want to spend it in a place where it is worth." Okay. And then a lot of impact of what we do is also been counted. Okay, the United Nations, a lot of studies have been done. When you correct burn deformities, what happens? They have found. It's called ROI, it's a return on investment. I think this is the way business economists talk about any healthcare. But nowadays, healthcare also, you need economical also, you need to be aware. And they said it's worth because the return on investment in correcting the post-burn deformity is 13:1. Okay, and this is based on the thinking that 25% of them getting 25%, they become functional. But actually, what happens is that we are now able to make them even more functional. Thinking there's 25%, that it is like this. As far as I know, only one other disease, where philanthropy gets more return on investment. That is, correcting vision cataract. But the amount of money spent, what they get, is only cataract, gets better. But whereas this one gives the next second best. So we need to tell people that when you treat a child like this, the return on investment for the amount of money somebody makes is that it phenomenally goes a long mile. I keep telling everybody, every rupee donated travels a long mile. And also say, as surgeons, a lot of plastic surgeons are there. Our country is blessed with a lot of plastic surgeons who are good-hearted, and many will do it free. And the funds are utilized only for the hospital excellence consumables, so that we can do, go for a longer group of people. Now we can go. Okay, that should be my point.
Sir, very rightly you have said कि लोगों की जो रिस्पॉन्सिबिलिटी होती है कि वो बर्न को एक पार्ट का नहीं समझे कि एक कोई अंग जल गया है, बल्कि उन्हें समझना है कि उस बच्चे का या जो भी पर्सन बर्न का विक्टिम है उसका पूरा जीवन अफेक्ट हो जाता है। बच्चों के केस में उनका स्कूलिंग जैसा सर ने बताया, और बड़ों के केस में उनकी नौकरी और उनका जो जीवन ये है। तो दिस इज अ वेरी गुड थिंग जो सर बता रहे हैं कि द सर्जन्स जो बर्न स्पेशलिस्ट हैं, they should think on that way, that they are not only spending right now, but it goes a very long way. Whatever they are spending today in the form of free surgery and free expenses for the patient, it will reflect in the future when the child will be able to go to school and receive his or her education. So very nicely pointed out, sir. So I would like to ask you one question here. What should be the responsibilities of the community participants and the local leaders for these community outreach services for the burn patients, like especially in the rural areas? How
So
can the local leaders?
How can the local leaders help now, Veena? You will see when we started this project, so as I told you, it just started off accidentally. Okay, we also really do not know the magnitude of the problem that's lying in the society. Okay, I was totally unaware. I'm very honest with you. And then suddenly we'll face up with patients, who have been like that for 18 years, 20 years like that. So the community leaders, they got two responsibilities. One, identify the potential beneficiaries, because in a village, they will know who has got a deformity. Okay, just like pointing hands, come, there is a place there you can do. Go to a plastic surgeon, they'll make you better. Okay, that finding, telling them and directing them to the right places. I think that's very important. I think in our country right now is travel is not difficult, but knowing where to go is difficult. I think I always keep telling in trauma also. And now ambulance services are very good in our country. 108 is very good. Okay, the question is now, it's not a question of how to go. Then the question is now where to go. I think that's very important. I think we're going where. So the first responsibility of community service leaders is that they need to point out it's possible. I think that part of it they have to give it one. And second is also they need to participate in the problem. They need to. I'll give one example. I'll give you. Say this girl. This is a very heartrending story. So you will find, this girl got injured when she was 2.5 years of age, not 2.5, 2.5 years of age. We saw her when she was 15 years of age. From 2.5 years to 15 years, that means 12.5 years, this hands has been like this. Okay. See, you see, then that's the one hand and that's the other hand. Okay, this one hand, this other hand. You don't know where the hand is, where the fingers are. So she has never done anything with one hand. And then we need to really appreciate the fortitude of these people. They all go back to society. They all go back and they go to school. And she writes with both hands. She used to write. She used to hold the pen and write with both hands and all. So here we took her up, and then they really didn't believe we'll do that. And that's the making of a hand. The hope makes the hand. Slowly, one by one, we bring it out, waving out, and make the fingers, make this thing. We made it. And now she's, once you did the left hand, she starts eating. And when you did the both hands, she's combing. She has never been able to do all this before. And most important is at the end of it, when everything is over, when she came back once, I just asked her, what is the thing which makes you most happy? Okay, you are also living before, you are eating before, you are going to school before. Okay, she, what I really, she cried, and also I could also found it difficult to hold the tears back. She said, every day we used to have a small period for games. At the end of the games, the teacher used to say, all of us have to go wash our faces and come back. Okay. But the problem was I was the only one, and I cannot wash my face because I never can hold water in my hands. I think once you did it, I think for the first time in my life, I could hold some water in my hands and splash it on my face. It's something very simple, but it's so nice that she said. It's amazing. I think what this was what to know what this what burn contracture releases can achieve. But then if you see Veena, this happened at 2.5 years of age, and we see her, when she's 15 years of age. Okay, here is the role of the community leaders, to find they all have to really work hard to find out the solution for this. I think that's the point, Veena.
तो बर्न के जो रोगी हैं उनके बारे में जनप्रतिनिधि और अभिनेता नेता अभिनेताओं को बताना पड़ेगा कि ये बर्न की उपचार कहाँ पे किया जा सकता है, कौन सी सेंटर है जहाँ पे एक्सपर्ट केयर अवेलेबल किया जा सकता है। बर्न के जो विक्टिम जल गए हैं उनके हाथ, जैसे किसी हाथ का डिफॉर्मिटी है, उसी जगह पे कहाँ पे सबसे बड़ी समस्या है कि कहाँ पे सर्जरी किया जा सकता है, वो सबसे बड़ी समस्या है। और कैसे जाया जाए, वहाँ पे यातायात किया जाए, वो सब बताना पड़ेगा मरीजों को। और ये रेस्पॉन्सिबिलिटी सभी जो जनप्रतिनिधि हैं, नेता हैं, उनको बताना पड़ेगा कि कैसे अच्छे से जो जल गए हैं मरीज, उनके उपचार किया जा सकता है। So I'd like to quote one thing from a book. Like most of the what exists in this universe, our action, all our forces, resources, and ideas, has little value and yields little result. On the other hand, a few things work fantastically well and have tremendous impact. So, if we are talking about surgical services, what factors do you think will improve the outcome of these setups?
Yeah. What really, can you rephrase the question again there?
Sir, we are talking about surgical services for these burn victims.
Correct.
And I'd like to ask, what factors do you think will improve the outcome in these setups?
Yeah. One is that, we need to really look at business models, Dash. And, I like reading a lot of other things other than medical books. And Bill Gates, I think all of us know Bill Gates. And he does a lot of charity. So they really asked him about charity, his missions, his ideas and all that. One of the two things I like it. One he said was, if you want to do charity, it must be run with the same efficiency as the main business which allows you to do the charity. He said that all the charity things must be run with the same efficiency as Microsoft. Okay, so what we do is, now if you have to run this set of camps and all this, you really have to run it very, very, very efficiently, one. And second, as I found that people must have an address to come back to. I think that's my point. If you do something and they do have some problems, and this I started thinking when we are doing the lower limb injuries and all, you give an amputation, you give a prosthesis, one of the things I found was the prosthesis service in the country was not very good. They'll put a prosthesis, but then something will get loose. That means, if that is small thing is not correct, it's not using the prosthesis. So that means, you need to get an address to come back to. It's not that you offer it by Amazon, get a prosthesis and keep wearing, If you have a small problem, you have to get it. So similarly, I think when we do these children, or when we do these children, my main point is that we need to think we are running a marathon. Okay, it's not a 100-meter sprint. That means we are leaving behind a legacy. It's difficult to do, but as you said, you nicely put a nice quote. This also still in the same way. When you do things which others find it difficult or say it's impossible, you leave behind a legacy. Means like this, you do something which makes it. For that, what we need to do is that we need to have an address to come back to. Okay, I think that's what is very important. I would feel that so. So anytime you do a patient in camp, you have to tell them 24/7, 365. At any time you have a problem, you need to come back. You can come back and contact us.
So that's an important point, sir. जो आपने बताया है कि इन सेटअप्स जहाँ पर लोग फ्री कैंप्स या फ्री सर्जरीज ऑफर कर रहे हैं कम्युनिटी को, they have to put these services with the same passion as they are doing with their main business. तो ये बहुत जरूरी है हमारे बर्न स्पेशलिस्ट और हमारे प्लास्टिक सर्जन्स के अंडरस्टैंडिंग के लिए। और आप जितना पैशनेट होइएगा टुवर्ड्स योर कम्युनिटी आउटरीच सर्विसेज, ऑब्वियसली सेटअप में जो आउटकम दे रहे होंगे वो उतने ही अच्छे से इम्प्रूव करेगा, and you will be able to impart better results. Sir, one question I would like to ask you. Nowadays, the quality of healthcare is an important topic.
Yeah.
And in the community, there is much of misunderstanding that anything which is offered free is not of good quality. So do you think the quality of service being provided in these free camps are of the same quality as we are giving to the other patients?
Yeah. It's true, we can make it. It all depends. I think that's what we showed, and that's how this project grew. Initially, when we started, people had a lot of doubts. Rotary people also had doubts. They said, no, this cannot sustain it at all. But then when we said that only way to reduce the cost of care or leave something good is to have high quality. I think I have a small definition for charity and service. I always used to say it, or people, service is not providing trash cheaply. Service is not providing trash cheap. It's providing quality at affordable price. I think that's quality. I think that's what is service. When you want to run an institution. But here we are doing it totally free. And that means it has to be even more better. But we find that in our this thing, I think it's everywhere it's the same, many places the same. And that because the surgery is free, what we tell is nobody likes a complication, but this fellow who takes a free surgery cannot afford a complication. They can't afford time away. So that means, the most senior people operate all the charity cases. Charity cases are not operated to get experience. Charity cases are operated by experienced people. I think that we proved to the world. I think once we started doing it, then what happened is, the trust on this project improved. People now started putting money. I'll just put you some example. This type of patient. I think I'll start with this case. A wonderful case to show. See, this was the same person who became like this. Okay, this was the same person who came and became like this. So while this is his face, that means once he gets into his house, he can't come out, and he can't come out. He can't take a public transport to come to a hospital. Then that means he need to go to this thing. But if this is his face, that was his hand. Yeah, that was his right hand. No? That was his hand. I think to us, even the face is easy to do. I think the face is much easier to do than to get this hand right. That was much more difficult. This was done entirely free. Entirely free. I think that's the face. We had a major, he had a ALT flap on his neck. That's his mother. And see the hand, the same hand which is so bad, after multiple procedures. So we can confidently tell that as plastic surgeons, when we do things, we go for quality. And we have the same points, this sort of charity is not for getting experience. It's not for getting experience. I think I'm totally against it. The best of the team persons have to do it. And whatever the type of demands of the patient, I think that patient does. So once we prove it, I think the people community also recognizes it, and then they also support us in a very big way. Does it answer the question? I think this should go to tell you that once this has been totally free, then everybody will agree, that such a quality thing has been done. He has not given 1 rupee for his cause. He has not paid 1 rupee to his cause. I think, so it could prove to the world that we really mean business, and then we really are honest to the core.
So, as Sir has said, the charity cases are not done for experience, rather than they are done by the experienced people.
Correct.
So, ये सब कैम्प में बहुत ख्याल रखा जाता है कि कैसे क्वालिटी मेंटेन किया जाए और बर्न मरीजों को सही उपचार किया जाए. और ध्यान रखा जाए, जैसे साधारण हॉस्पिटल में जैसे सर्जरी किया जा सकता है, वैसे कैंप में उसके बराबर क्वालिटी मेंटेन किया जा सकता है। सर, as we know, the COVID pandemic since last 2 years has changed so many aspects of our life, and the technology has stepped up, and the telemedicine is something that we are experiencing day by day, and it is increasing presence in our lives. When I have visited Ganga, I have experienced the telemedicine at your unit is very good indeed. So I'd like to ask how these camps can be different from telemedicine facilities. Will the telemedicine supplement or complement these camps?
Yeah, good. So it's such a lovely question. We debate it very often as to what's the role of telemedicine. To my mind, however much technology may go, nothing compensates for face-to-face. Nothing compensates for a doctor's touch, a mother asking you. So when you look at telemedicine saying, this range of movement is not there, okay, that's fine. But then at the same time, what really clicks the whole thing is the face of the mother, as you keep seeing, the expectant look in their eyes, the anxiousness in their face, and then the messages that they convey about the expectations and their suffering. Those things are not able to be got through telemedicine. That's my point. Telemedicines are extraordinarily good. I think I don't think we can say it has got a place to stay, and it will stay. They are very, very good to as a source of for follow-up. For follow-up is extraordinarily good. For example, if I do this person, and then normally if he has to, he is from about 80 kilometers away, 70, 80 kilometers away. For him to follow up, he doesn't have to come. If I see him in telemedicine that he's able to pick up all these things and put back, that means his hand is good. Okay, for that it is good. And if he's not doing well, then I say, oh, you need to come. I think that for that telemedicine is good. But whereas, to get that bonding, for that to get better results, I think you need to really see him. I just put you give another example for a show. For example, this child, Suhash, where you got this right hand is a left hand. See, so bad hands, This again happened by a small kitchen accident. Okay, and both hands like this. Then 1.5 years child is gone. I think see the hands, see the fingers, they're all gone. And this usually happens to people who are very poor. This thing for them, if you show it in telemedicine and all that. Because they also, what we can do something, but they also have to do a lot of things. That means, a lot of things, putting the splint and all that. I personally feel that, we are able to get it much, much better when we see them. The same child. See, the hands are made and is, is a bigger grown-up boy. But in this part of it, there's a lot of, pushing our ideas back into the field, getting to the next stage, going back, all that. That is done by a face-to-face contact, and telemedicine to a great extent can supplement our ideas about follow-ups and convincing people that they have to come. Does it answer your question, Suhash? The role of telemedicine versus face-to-face
Yes, sir.
interactions?
Yes, sir.
यस सर, आपने बिल्कुल अच्छा बताया कि टेलीमेडिसिन सर्विसेज कितनी भी अवेलेबल हो, जो पेशेंट के साथ फेस टू फेस इंटरेक्शन होता है, जो फिजिकल टच से हमें बहुत सारे इंफॉर्मेशंस मिलते हैं अबाउट द एग्जामिनेशन एंड हाउ द पेशेंट एंड द अटेंडेंट्स आर सेटिस्फाइड, हाउ मच दे आर सेटिस्फाइड, वो कंपेयर नहीं कर सकते हैं टेलीमेडिसिन से. तो फिजिकल कंसल्टेशन का अपना अलग इम्पोर्टेंस है, telemedicine consultation के अपने अलग importance है. So I would be asking you one very important question that all the patients whom you are offering free surgeries under the Hope After the Fire project, are they or their family members given some education also regarding the prevention of burns and what are the care they have to take care of regarding their deformities, maybe the post-operative follow-up and the physiotherapy protocol, so that they can go back to the community and tell them also why prevention is important and what has to be done immediately after burn. I just need to ask you to highlight on the IEC material which you are giving to the patient at your camps, at your center.
So, yeah, what we do is most of these patients stay for quite some time. They're not that, no, these are all not 1 day, 2 days, no. So at the time, every time we see them, we always tell them how this could have been avoided. The first point is that now we tell them how this could have been avoided. Still about 70% of the people, when they come to us, they do not know that when you have burns, you can pour water. Still, I think all of them. And then if every time we go back in this to what you did, they said blanket, this, that, switched off, so many other things they tell, but then not pour water. So at least now we tell that every time, now they are in a very receptive mood, They are in a they are a great target audience. They are very receptive. Whatever you tell, they are going to listen. And we tell them that whatever we tell, at least, you tell 10 other people whom you see. I think 10 other people, tell it tell to everybody in your family, you tell them. Okay, that's you tell. And burn contracture releases, the rehabilitation services that we do, 100% the complaints has to be there with the patient and the family. Okay, it's very important. So if we really go into the family, anytime we find problem, we only ask them now, so this has been suffering for so many years, why you didn't come? But it'd be very heartening it'd be very difficult to understand. In fact, it's a tragedy when they tell, and it's a fact. Sir, it's not a 1 day, 2 day affair. They say that I have to just be there for about 3 weeks, 4 weeks. Then I am the only sole breadwinner of the family. I'm working as a driver. If I apply for leave for 3 weeks for my family, I may lose my job. That means it is not just enough. We have found like that. Just because we offer something free to the patient, not that everybody will take it up. It is so difficult because we need to understand the whole family systems and why they are not taking it up. We go deep into the problem and then give them the solutions. Then we find out how to get the physiotherapy done, all that. Now we continue to give them in that way. A lot of talking, has to go. And it's not possible for the doctor to talk all the time. You need to have your a physiotherapist talk, your social worker talk. Anybody who sees, talk. I think talk. That's the mantra.
So, as sir has said, जैसे बताया, prevention is always better than cure. कैसे जलने से बचे वो ज़्यादा महत्वपूर्ण है और उन रोगियों के परिवारों के लिए जो जल गए हैं उनको बहुत अच्छी तरह से समझाया जाना पड़ेगा कि कैसे जलने से बचा जाए और डिफरेंट जो विभिन्न प्रकार के जलन हैं, फ्लेम बर्न, इलेक्ट्रिक बर्न और डिफरेंट तरह के हैं, कैसे उनसे बचाया जाए. सिर्फ सर्जरी नहीं, बाकी खान पान और अदर जो वर्जिश और एक्सरसाइज की भी कितना महत्वपूर्ण है सर्जरी के बाद, क्योंकि जलने के जो सर्जरी होते हैं वो एक तरह से लॉन्ग टर्म प्रोसेस होता है रिकवरी के लिए. ये सब भी उनको बहुत अच्छी तरह से समझाया जाए. सर, one important question I would like to ask, as we are shifting from surgeon-centric outcome to patient-centric outcome, the WHO is emphasizing on patient information, patient empowerment. So, as a patient point of view, what are the necessary things he or she should know before attending these camps? How to reach, who is the ideal contact person, not to, and most importantly, not to get misled in these things.
Yeah. So you rightly said, people must not be misled. I think many a time when we ask people, we run a camp in a place, and the most deformed person doesn't come to the camp. If you ask them, we have come many times, they have been offered so many things and then it doesn't happen. Okay, what really requires is trust. I think that we have to develop that, and they should not be missed. I think it all has to be led by the top people have to lead. I think I always say that camps, all this has to be led by the senior people. Input is important. Personally found if it is done by junior people, younger people, sometimes some questions which they ask, if it is not answered properly, that means they may not come to the camp at all. They may not come to get to the treatment at all. I think that's the point. Okay. We need to have a lot of empathy, and we need to look at in their point of view. In their point of view, you need to look at it in their point of view. Once they understand that you are looking into their point of view, and then you can tell them, then when we do this, you have to do this. I think we can do up to this, and you have to do this. And as WHO said, the patients have got their rights and their liberties, everything they have got. Similarly, they need to put everything in the right perspective, so that they have to understand that we are together working for a common goal. I think that's very important. And we recently attended one of the award ceremonies for the quality, where Rajiv Bajaj was the younger person. He was there, he was talking. When someone has asked him, he's narrated an incident, he gave the example of a great film producer, but I don't remember the name of the film producer. When he was asked, how is that you are continuously producing great pictures in the Oscars? They asked him. He said, it's very simple. I think the whole team must be making the same picture, he told. I think that's a fantastic, it's a sort of very philosophically well-meaning thing. The whole team must be making the same picture. Okay, all of us must same. It's there from the director, from the producer, from the actor to the thing, and to the person who is going to see. I think it has to be the same thing. So similarly, when you're doing it as a charity project, if all of us are trying to make the same picture, I think the same end result, then it is be fine. The patients also reciprocated us. That's my idea.
So very nicely pointed out, sir. लोगों के लिए ये जानना बहुत जरूरी है कि जो फ्री कैंप्स में बर्न्स के लिए सर्जरी आपको प्रोवाइड किया जाता है, वो बहुत ही सीनियर एंड एक्सपीरियंस पर्सन के द्वारा होता है, और उनकी पूरी टीम का जो उसमें इनपुट और एफर्ट्स और हार्ड वर्क होता है, वो बहुत ज्यादा होता है. इनफैक्ट बहुत ज्यादा केयर करते हैं, और आपको सही जगह पे पहुंचना है जहां पर आपको क्वालिटी सर्जरी प्रोवाइड किया जा रहा है एट अफोर्डेबल प्राइस. जैसा सर ने कहा कि फ्री का मतलब, सर्विसेज का मतलब यही होता है, क्वालिटी services at affordable price. So sir, one last question I would like to ask you, that do you want to give some important message for the new burn specialist who are associated with various projects and various NGOs who keep organizing these free camps? What extra precautions they have to take care apart from providing the quality of care, because there are many cases of litigation, and then there is loss of trust, and then going into the community and operating, providing the patient a long-term follow-up along with the physiotherapy becomes a very challenging job. But they should not be discouraged in performing these free camps. So message for the burn specialist, sir.
First of all, I would like to always tell people, in a case, if you take a triangle patient, an NGO, and a surgeon, I always feel the surgeon has to be the top of the pyramid. I think we need to take up the leadership roles. I think once we start taking the leadership roles, then everything become all right. I think that's the point. In the sense, we also need to assess the NGOs. I think NGOs, if they are trying to do, what's the motive of doing that? I think if they have to see if the whole thing has to be to the cause for the same, like I told you, in the same picture. All of us make the same picture. So if they think that the interest of the burn patient is only interest to be considered, then it runs off very nicely. But then if you say it's for publicity and all that, no, then it's become, and you need to tell them, burn projects are not one-off days like this. No, you just do it. It's not like cataracts. It's not like small disease where you do this, check it up, and then eye refraction camps like that. It's if you do this, that means we need to run the long way. I think that's what we need to tell them in the very beginning, because most people do not sustain. I think that's the problem. Most of the NGOs do not sustain, but we need to tell them that there are a lot of people to do a lot of small things. I think this is a big thing. You need to, if you want to do a big thing, we want to need a lasting impact. You need to choose a project like this. I think that's what you need to really inspire them to do this. I think that's the thing that is very important. I'm not really worried about litigation. I think provided it's just like any other case you do, no? Even in a camp case you do, your the way you record, the way you write the case sheet, the way you write the operation notes, the way you dress, everything has to be the same. You cannot have any different way. I think once you do it in a different, you don't do it in any different way. I'm not worried about litigation. And in fact, I would think there are a lot of people looking for good projects. In fact, a lot of people are looking for good projects, and we need to really, really emphasize this is the best project where your CSR money can go. Okay, this is the one good way where your CSR money can go. I think that once we do that, I'm sure we should be, we will be flooded with a lot of patients. And my idea is that no patient in India, I think for anyone in the world, must suffer from the burn deformity either due to a lack of awareness or due to lack of affordability. I repeat it again, no patient in our country should suffer from burn, needlessly suffer from burn deformity, either due to a lack of awareness or lack of affordability. I think it should be possible by if all of us just do it, I'm sure it should be possible.
Beautifully said, sir, that people should not be deprived of their right to burn surgeries. And लोगों के लिए ये जानकारी बहुत इम्पोर्टेंट है, जैसा सर ने बताया अपने गंगा हॉस्पिटल में सर पिछले इतने सालों से ये बर्न प्रोजेक्ट चला रहे हैं, आप लोगों को शो भी किया। उसमें ये इम्पोर्टेंट है कि क्वालिटी कहीं भी कंप्रोमाइज नहीं होती है, नो वेयर क्वालिटी इज कंप्रोमाइज, इट इज द सेम क्वालिटी सर्विस विच इज बीइंग गिवन टू द अदर पेशेंट्स। तो आप लोगों को विश्वास रखना होगा अपने ट्रीटिंग डॉक्टर्स पर, और जो हमारे बर्न स्पेशलिस्ट हैं, प्लास्टिक सर्जन्स हैं, जो न्यू हैं इस वेंचर में, फ्री कैंप्स के साथ जो न्यूली एसोसिएटेड हैं, उन लोगों को ये समझना होगा कि अपार्ट फ्रॉम योर डेडिकेशन, winning the trust of the patient, it is also important to get the funds from the right body. आप चीजों को ऑर्गेनाइज कर सकते हैं, आपको पैशनेट होना है, फ्रॉम डे 1 टू द लास्ट डे ऑफ पेशेंट का जितना भी उसका जर्नी है उसमें आपको लगे रहना है फॉर एनी अदर पेशेंट. So thank you so much, Dr. Raja Sabhapati sir, for a wonderful talk, experience sharing and enlightening our patients, our general public, their the patients' family members and the burn specialist and even the non-medical people regarding the things which they are supposed to know about the community outreach services, because there has been many confusion, many misunderstandings.
Yes.
So you have clarified almost everything. And thank you, Dr. Subhashish, for taking up the questions very nicely and interpreting sir's answers for our Hindi watching viewers.
Yeah. Thank you so much for that.
Thank you, sir. Thank you, ma'am.
And now I would like to invite Dr. Raj Manas, my co-host for these public tutorials. He has been very hardworking and putting in lots of efforts to make all these webinars, the online tutorials successful. So Dr. Raj Manas is a plastic surgeon from AIIMS, Delhi, and would like to invite him to propose the vote of thanks and to announce our next meeting.
Thank you, Dr. Veena. Listening to Sabhapati sir is always not only informative, but always inspiring and motivating. And I always feel that I'm back to his class and I'm always listening to him. So I'm very thankful to Sabhapati sir who shared his thoughts and knowledge with us today. And his messages to all plastic surgeons as a leader for providing such services for surgical services or for medical services for the burn victims. It was really very important, and for all the audiences who has been connected with us, what sir told, it's very important to know that where to go, because patient in India, it's very important that patient can go anywhere in the country. So it's very important for to know all the patients that what are the NGOs and what are the hospitals they are providing such services. So I'm very much thankful to our moderators, Dr. Veena from AIIMS Patna and Dr. Subhasis, who played their role very nicely. And our team member headed by Dr. Sanjeev Uppal sir, with under his leadership only, we have achieved about 33rd NABI tutorial. So I'm thankful to all of you, and our next program will be on the third Sunday of the November, third Sunday of the October. And as we know that our Diwali festival is coming and we get a lot of firecracker injury, so we'll be focusing on prevention of those firecrackers injury in our next program. So thank you for being with us and have a good day.
Thank you so much.